please join me in welcoming Sarah Weaver from Cala.
Thanks, Amy. Welcome, everyone, and thank you so much for joining. This is Cala Health's first annual Facebook Live event, and we're happy that you're here this evening and really appreciate you taking your time. I wanted to share a tiny bit about Cala Health. We are a bioelectronic medical company headquartered in the San Francisco Bay Area, and we're committed to transforming the standard of care for chronic diseases like essential tremor. So Cala merges innovations in neuroscience and technology, and we deliver non-invasive peripheral nerve stimulation. And that stimulation is uniquely calibrated to the individual needs of patients with movement disorders. So as you all well know, essential tremor can be a really debilitating disease and can tremendously impact one's life, both physically and emotionally. And sometimes the emotional impact goes a little under-recognized. So we're eager to shed some light on this condition during National Essential Tremor Awareness Month this evening. I'm going to introduce our panel members. We have board-certified neurologist, Dr. Dhira Khosla, who will talk about her experience diagnosing and treating patients with essential tremor. And then as part of my role at Cala, I get to work with consumer advocates. And so additionally, this evening we have Ben, who is a veteran and a patient advocate for Calatriol. So both Dr. Dhira and Ben will talk about treatment options and their experience with Calatriol specifically. Calatriol is our FDA cleared wrist-worn non-invasive therapy, and it is indicated to treat hand tremor in adults with essential tremor. Thanks again to all of you for taking your time this evening, and I hope it's well worth your time and you find it valuable. Let's begin the event.
Thank you so much, Sarah. As Sarah said, I am going to turn it over to our guest speakers now, Dr. Dhira and Ben, by asking a few questions so that we can get the conversation started. First, I'm going to start with you, Ben. Can you tell us what your connection is to essential tremor?
Yes, be glad to. Hello, my name is Ben Duncan. I am a military veteran. I served in the United States Air Force for 21 years in both the officer and the enlisted ranks. Essential tremor turned my life upside down, and I am excited to tell my story and also to celebrate Essential Tremor Awareness Month together with you tonight. Now, I would like to hand it over to Dr. Dhira Khosla.
Thank you so much, Ben. Hi, everyone. I'm Dr. Dhira Khosla. I'm a neurologist in the San Francisco Bay Area. I'm board certified by the American Board of Psychiatry and Neurology, and I'm fellowship trained in electromyography, nerve conduction studies, and neuromuscular diseases. I received my bachelor's in science from Villanova University and my DO in medicine from the Philadelphia College of Osteopathic Medicine. During my 13 years of neurology practice, I've diagnosed and managed many patients with essential tremor. And I'm just very happy to be here today to share my experience on this topic.
Excellent. Thank you both so much. My next question, back to you, Ben. How would you describe your essential tremor?
Well, my essential tremor began over 9 years ago, 1 year before I officially retired. They began slowly, and as they worsened, I visited my local general practitioner doctor. He ran tests on me, looked at my family history, ran some practical tests on me, and diagnosed me with essential tremor. and prescribed me some medications. What he told me about essential tremor, and I knew nothing about it, was that it affected over 10 million people in America and millions more worldwide. The first thing that I noticed is that it affected my penmanship. And living with essential tremor, it affected my daily activity, such things as my writing, me doing my daily task and my hobbies, me getting dressed in the morning, and me eating. It affected everything that I did.
Thank you, Ben. That's very informative. Dr. Dhira, can you tell us from a general perspective about the same topic?
Sure. So essential tremor is a movement disorder that's characterized by involuntary shaking or tremors, and that most often occurs in the hands. As Ben was just describing, in essential tremor, the tremor usually occurs when the hands are performing an action or when they are held up against gravity. So for example, tremor can be present when someone performs an action like having soup or drinking from a cup. Tremor can also be present if someone is holding up a newspaper or holding their arms out in front of them. In addition to affecting the hands, tremor can also affect one's head, one's voice, or even the legs if the shaking is really severe. Essential tremor is much more common than Parkinson's disease. Although it is the most common movement disorder, there are not very many available treatment options for essential tremor. And because the tremors affect activities of daily living, it can be incredibly frustrating, and it can sometimes lead to social isolation and even depression.
Excellent. Thank you so much. Now, Ben, for you, can you go into a little bit more detail about your specific symptoms from essential tremor?
Yes, I will be glad to. As I said earlier, my penmanship was the first thing to suffer. And I took a lot of pride in my penmanship. I received a lot of compliments for its beauty. And as the tremors increased, I saw a significant increase the first year. And it took a downward spiral for me. I tried to ignore it at first. I tried to focus on bigger daily activities and my woodworking, but those didn't work. And my tremors got in the way of that. I would wake up in the morning, kick my feet off the side of the bed, and I'd hold my glasses out as a test. Was I going to have a good day? Was I going to have a medium day? Or was I going to have a really bad day? Tremors, or the shakes, as my wife and I called them, turned my life upside down. I felt frustrated. That I went from a person that was in control of my life to somebody that was not in control. I felt like a stick of dynamite ready to explode. And when I would explode, it would be like it would be a verbal explosion, and unfortunately, most of the time it was at my wife, and that wasn't me, and that hurt. That really hurt. I would experience emotion and behaviors of depression, anger, and boredom because of the tremors. These behaviors weren't me. These only created more tremors. These might be the same emotions and behaviors as somebody who were experiencing PTSD or alcoholism might experience as well. With essential tremors, I couldn't grasp, I couldn't hold a fork, I couldn't hold a glass of milk. I had to learn all new behaviors. I had to learn to use my left hand. I had to learn to grasp a computer mouse. I had to learn to drive a car with two hands instead of one hand. I had to learn to drink water or milk with the left hand instead of my standard right hand. My wife and I can remember on my worst day, the worst bad tremor day that I had, she had to spoon feed me. And this scared us both to death.
Thank you so much, Ben. That was really eye-opening. Dr. Dhira, can you explain to us some general symptoms of essential tremor?
Yeah, well, tremors can have a significant effect on a person's life, as we just heard from Ben. And as Ben just described, some signs of essential tremor include difficulty with handwriting and using tools. And as we mentioned earlier, you can have difficulty holding a cup of tea or holding a book or newspaper. But in addition to affecting the hands, essential tremor can also affect other parts of the body. And you might notice that either you or your loved one has shaking or quivering of the voice. You could also have uncontrollable nodding or shaking of your head. In rare instances, tremor can also affect the legs or feet. Generally speaking, patients who have essential tremor have a tremor which is fast and small because the frequency is typically fast and the amplitude or height of the tremor is generally small. This means that hand tremors in essential tremor usually appear to be smaller and faster as compared to tremors in Parkinson's disease that are generally slower and bigger. Now, the cause of essential tremor is unknown. However, in most people, the condition does seem to be passed down from a parent to a child. And the symptoms of tremor do worsen slowly as time goes on.
Thank you very much. Now, Ben, we've heard a little bit about the symptoms that you experienced. Can you take us through your diagnosis journey?
Yes, be glad to. As I mentioned before, my tremors worsened. I visited my local GP doc. He had diagnosed me with essential tremor and prescribed meds. At that same time, I'd made a appointment with my local Veterans Administration VA neurologist. He had confirmed my diagnosis. He agreed with my local doctor's treatment plan and just tweaked my meds. I continued for 4 years with my VA doctor. He increased the dosage until I was at the maximum dosage that I could be with the medication, but my tremors persisted. But the medications interfered with my life, and the tremors interfered with my life. Some of the side effects of the medications, I had balance issues, and I was feeling sleepy and drowsy. Last year, at one of the follow-up appointments with the neurologist, he told me I had 3 choices. 1, I could continue With the tremors, I'd improved a lot, but I still had tremors, and I could continue on the meds and still live with the side effects. 2, I could elect brain surgery. Somebody tinkering and operating on my brain scared me to death. Or 3, I could try a new FDA cleared, VA cleared, wrist-worn device called Cala Trio, which meant no surgery and possibly no additional medications with potentially no or lesser side effects. Trust me, I jumped at the chance. The doctor wrote me a prescription in January 2020. And I went for it.
Excellent. Thank you so much, Ben. Dr. Dhira, can you explain a typical diagnosis journey for essential tremor?
Sure. So as I mentioned earlier, hand tremor in Parkinson's disease generally appears different from the tremor in essential tremor. Also, typically, if someone has signs and symptoms other than tremor, that can point toward a diagnosis of something like Parkinson's, stroke, or other issues. So it's very important to make an appointment with your doctor and discuss all of your symptoms so that they can arrive at an accurate diagnosis. There are no medical tests really right now to diagnose essential tremor. Diagnosing it involves reviewing your symptoms as well as your medical history and your family history. It also includes conducting a thorough physical examination to help rule out other causes of tremor. When you go to see your doctor, they may ask you to do some performance tests as part of the physical exam. These could include drinking from a glass, holding your arms outstretched, writing a sentence, or drawing a spiral. The current treatment options for essential tremor include medications. The most common are propranolol and primidone, but studies have shown that the effectiveness of medications wears off in about 60% of patients. Plus, medications can have side effects and they can interact with other medicines that you might be using. Deep brain stimulation is an option that might be effective, but it's invasive and it involves surgery. Another option to treat essential tremor is focused ultrasound. This doesn't involve surgery, but it does result in a permanent lesion or scar in the brain. Which brings us to this new treatment called Cala Trio. It's the first and only non-invasive prescription therapy that goes directly to the source of your tremor. The therapy is calibrated to your specific tremor, so it's personalized for your unique tremor pattern. It's a wrist-worn device that delivers electrical stimulation to the nerves in your wrist. And these nerves project from your wrist to the networks in your brain that are responsible for generating hand tremor. So stimulation of the nerves in the wrist is thought to disrupt the brain network that causes hand tremor. And disruption of the network provides temporary but meaningful relief of tremor in that hand. The Cala Trio system is made up of 3 components. There's a stimulation device, there's a band, and there's a charging base station. The wristband of the Cala Trio system contains electrodes that deliver gentle electrical stimulation to the nerves in your wrist.
Thank you so much. My next question is going to go back to you, Ben. What's your experience been like with Cala Trio? Can you give us a little more detail on that?
Yes, be glad to. The setup of the Cala Trio device is simple and straightforward. Within 1 day of the Cala Trio device arriving on your doorstep at home, a Cala Trio customer service team member calls or arranges a Zoom setup meeting with you, and they walk you through it and sets it up. The recommended 3 40-minute sessions per day do not interfere with your daily activities. You can go about your normal activities. I can say for me, Calatriol made a drastic, life-changing difference in my life. If I can use the analogy of a gas gauge in a person's car, that's the simplest way that I can explain it to me. Before essential tremor started, my gas gauge was pegged at completely full. Essential tremor started and my gas gauge started slowly moving. But then, as I said, the downward spiral started and my gas gauge started moving pretty quickly. But then it started moving even faster. I explained to you my very worst day where my wife had to spoon feed me. I was right at the red mark. I was sucking fumes. Well, when I saw my doctor and they prescribed me meds, the meds helped, but for me, I would peg myself at maximum meds about that level. Well, along came the Calatriol device. I put that on with my three times a day, 40-minute session. Well, guess what happened? Right now, I would see myself at near normal. I am just about pegged out. I am back to near normal, thanks to that. What I can do now, I can use my right hand. I can write, I can print, I can do my fine detailed woodworking again. Before all the meds, before Calatriol, my typing had dropped down to 20 to 25 words per minute with a lot of mistakes. Whenever you have tremors, you tend to make a lot of mistakes on the keyboard. I am back up to 55 to 60 words per minute with few mistakes. I can grasp things. I can eat with my right hand again. I can hold my glass. I can drink with very slight shaking. It's wonderful to be able to eat with my right hand again. It's wonderful. While everybody is different, I would encourage everybody who is experiencing symptoms with essential tremors to do 4 things. 1, speak with your health care provider. 2, get properly diagnosed. 3, discuss treatment options with them. And 4, advocate for yourself. Sometimes you need to be persistent and help your health care provider provide the best treatment for yourself. Thank you for your time today. I hope this information is helpful, and I hope that Calatriol is as helpful for you as it has been for me. Thanks.
Thank you so much, Ben. Dr. Dhira, can you give us just a little more information about using Calatriol from your experience?
Yes, so what I like most about the device is that patients can use it at home. This gives them the freedom to use it when it best fits their schedules. I've seen great success in patients who've used the Calatriol, but its effectiveness does vary among patients. So the only way to know how effective it will be for you is to try it. The Calatriol can be prescribed in your doctor's office or via a telemedicine visit. So far, it's only cleared for sale in the United States. It has been shown in clinical studies to be as effective as medication without the adverse side effects that medications can have. There were only minimal side effects of irritation reported in the clinical studies. These side effects almost always resolved after changing the setting at which the stimulation was being delivered or after taking a short break from using the device. So thank you everyone for having me here. I'd just like to say that in summary, Cala Trio is a risk-borne non-invasive device that has been cleared by the FDA for treatment of essential tremor. There are no surgeries or invasive procedures involved, and I really hope you consider asking your doctor if Cala Trio therapy is right for you.
Excellent. Thank you so much. I think this information was extremely helpful and informative. What I'm going to do now is I am going to take some questions. I know that a lot of people have been putting questions in the Facebook chat, YouTube, as well as Zoom. So I'm going to bring the panel back up and give some questions over to Dr. Dhira, to Ben, and to Sarah. The first question we got is for you, Ben. Did you feel anything when you wear the device and it is activated? How did it feel?
Okay, I will be glad to answer that. The only thing you feel is a slight tingle in the thumb and these two fingers. And it's just a slight little tingle, and that's it.
Excellent. Dr. Dhira, this question is for you. Some people asked if they are able to wear the device on both hands, if they experience tremor both on their right hand and their left hand, can the device be used?
No, so unfortunately the bands are not interchangeable. And the reason is that the bands have electrodes that are placed directly over the nerves that are being stimulated. So you can't put a right-handed band on the left hand. It just wouldn't work.
Okay. Thank you very much. I see a question here for Sarah. We do have a few audience members who are asking if the Cala Trio is covered by insurance and/or Medicare.
Yeah, so at this time, Cala Trio is not covered by Medicare or private insurers. Cala Health does offer a few pricing options as well as payment plans to try to accommodate patients' financial situations. Another option is if you have an FSA or an HSA, Cala Trio is a qualified medical expense. The pricing and payment options are worked out through our customer success department, and so you would need to call them and then work out the details of the payment plans that are available.
All right. The next question that we got in the chat, actually, it goes back to you, Sarah. There are just a few questions about the VA. Do you have more information on if somebody belongs to a VA, will their VA know about Cala Trio, and how can they have access to it?
Sure. Yeah. That we have many VA facilities prescribing Cala Trio for veterans with essential tremor. So the best thing to do is to ask your VA healthcare provider for Cala Trio. And we do have like a tool that's called the doctor discussion guide that you could take in case your healthcare professional is not aware of Cala Trio. But we have, prescriptions from many VA facilities for Cala Trio.
Excellent. Thank you so much. Dr. Dhira, we do have a few questions about people with different implants or elements that they have. I know that we can't get into specific diagnosing for individuals. However, are there any indications or elements that people should should know of, that would make Cala Trio not available to them?
Yes, so Cala Trio, because it's an electrical device, it is contraindicated in patients who have another electrical device implanted. So for example, deep brain stimulators, pacemakers, and defibrillators are contraindicated.
Okay, great, thank you. Ben, another question for you. How often do you wear your Cala Trio, and how long do the benefits last for you?
Yes, be glad to. The treatment period is for 40 minutes. And when I first started, the initial period was for 4 hours. And so I did my 3 times a day. But with the continued use, I saw that 4 hours extending. After the repetition of 3 times a day, I saw that period extending. And each individual is different. For me, after a little over 2 weeks, that period extended to 9 hours just because of my body and everything. And it has stayed between, for me, everybody's different, has stayed between 9 and 11 hours.
Excellent. Thank you very much. The next question I'm going to pose to both you, Ben, and Dr. Dhira. Have you experienced any side effects on the Cala Trio?
I will be glad to answer that. The only side effects is a near normal positive life. How's that?
Thank you, Ben.
For a side effect.
Excellent. And Dr. Dhira, from your perspective?
Well, in the clinical studies, like I said, I did see some minor skin irritation that, again, almost always resolved if someone took a short break from using the device or turned the level of stimulation down.
I will be glad to answer that from a realistic standpoint. I saw a little burning. And so what they recommended, this is from the Cala Success, is that I use some of the the gel like they put on EKG stuff,
Okay.
Yeah. And so I put that on the pads, and I've had no burning for 4 months. So other than that, it works great because of my.
Perfect. Sarah, we've got a question for you about potentially a trial of the product. Is there anything available to try out Cala Trio?
Yeah, that's a great question. So Cala Trio, I think alluded to this, Dr. Dhira alluded to this. Actually, we know it does not work for everyone, just like all, therapies for essential tremor. So what Cala is offering is a 60-day trial period. So the patient can get Cala Trio and try it for 60 days and try to really understand how does it work in their life. And I think, different patients are using it differently. Some are using it, before cooking. Some are using it, Ben, like before woodworking. Like everyone has kind of a different way that it's benefiting their lives. And so our idea is the 60-day will give patients an idea and a chance to understand how it works in their lives and if it works for them. And then if it doesn't work, the patients can return it. There is a $99 return fee for that 60-day trial.
Great. Thank you very much. Ben, my next question is back to you. Some of the audience members want to know if you are still currently on medication, or if your medication has been adjusted, and how is that going?
Okay. Currently, I am still on meds. I am in communication with my neurologist to begin the process to wean me off. Keep in mind, I am on the maximum dosage for the 3 medications. And I think Dr. Dhira had mentioned and showed the chart of those meds. Well, I'm on all 3 of them. And so that is going to be a long process for me to wean off those meds. So it's going to be a slow process for me to get off those meds. So currently, yes, I am still on the meds. I am working with my neurologist to get off those meds, but it's going to be a long process. My goal is to get off those meds completely.
Excellent. Thank you, Ben. I've got a question for Sarah. Somebody wants to know, how do they get a hold of a Cala Trio? What goes into getting a prescription, and what kind of doctor is able to prescribe that?
Sure. So Calatriol, I mean, like prescription medications, Calatriol does require a prescription from a healthcare provider. And so really, in terms of getting Calatriol, you want to have a conversation between you and your healthcare provider to discuss, how Calatriol may fit into your treatment plan. The prescription can be written by a primary care physician, a neurologist, a movement disorder specialist, really whichever physician is currently, working with you, with whom you have a relationship. So when you have this conversation, and if you're a healthcare provider and you decide to move forward with Calatriol, the physician can write a prescription, and then they actually fax the prescription for Calatriol directly to Cala Health. And then, like Ben said, we will ship it directly to your home.
Great. Thank you. Our next question is back to you, Dr. Dhira. If somebody is diagnosed with a resting tremor, does Calatriol work for them?
I think the company will have to do some more research to see whether it's going to work for a resting tremor. It's a new therapy. It's a novel therapy, and so we're still learning about this. The only indication that we have right now is for action tremor in essential tremor.
Okay. Another question for you, Dr. Dhira, is what if somebody has a head tremor or not a hand tremor? Will this device work for them?
Yeah, so similarly, because it's a new therapy, we're still learning how it can be helpful for other things. But again, right now, the only thing that we've really studied it for and found it helpful for is the hand tremor and essential tremor.
Great, thank you. Ben, we've got another question about your experience going through the VA. Was it an easy experience to get the Cala Trio? Was there a coverage issue or anything like that when you went to get the device?
I will be glad to answer that. I was the first individual at the VA clinic in Austin to receive a Cala Trio. I had to be a little bit persistent since I was the first one. I had to work and be a little bit persistent. I found out that there were 4 individuals at the Temple Hospital that were using it, and but there are individuals in the VA system using Calatriol, so that's where my little blurb that I put in about you need to help your healthcare provider. So the answer is yes, there are individuals in the VA system using Calatriol, and the VA is paying for mine and the maintenance, the monthly maintenance fee for my Calatriol.
Excellent. Thank you very much. Sarah, I've got a question for you. How often do you have to replace the band, and what is the life of the watch itself or the device?
Sure. So the band has a 3-month life, and the reason it has a life and doesn't last forever is it really works by electrodes, and that's what's providing the neurostimulation. And so those electrodes, don't last forever, so they last for 3 months. So the bands are part of a subscription, and that's part of the prescription. It's a subscription to bands, and then they're shipped to you every 3 months.
Excellent. This next question for you, Dr. Dhira. The question here is, somebody wants to know if Cala works for Parkinson's disease.
Right now, we don't have any evidence for that, but Cala Health, like I said, we're studying all these different disease states and conditions. And I think the company, I think Sarah was telling us earlier, is that the company is committed to helping patients with chronic conditions. So hopefully we'll have some information about that in the future.
Excellent. Thank you very much. We do have another question here. Dr. Dhira, what if my doctor doesn't know about Calatriol? What information do I give them to help get a prescription?
So you could go to the Calatriol website, calatrio.com, and there's a doctor discussion guide. So you could download that, print it, take it to your doctor's appointment. That just makes it easier for you to start the discussion with your doctor. Doctors themselves can also visit the healthcare professional page on Calatriol's website to learn about the therapy and how they can prescribe it.
All right. Perfect. Well, thank you so much to everybody here for joining today, for participating. Thank you to our panel members who have been excellent and answered questions from Facebook, from YouTube, and from Zoom. So this concludes the first annual Essential Tremor Awareness Month Facebook Live event. Again, thank you so much for your time. Thank you to the presenters for sharing your story. And if you have any other questions or need more information, please message us directly, either on the Facebook page or contact us at the email address provided on your screen. Again, thank you and have a great night.